The Thal Quick chest tube set consists of an introducer needle, a wire guide, dilators, a coaxial chest tube inserter, and a clear catheter with radiopaque strip. The Thal Quick chest tube is intended for percutaneous introduction of a chest tube for pleural fluid drainage. For complete instructions, contraindications, warnings, and precautions, see the instructions for use that are included with the product. Prepare the chest tube insertion site with antiseptic solution and drape in a standard fashion. A mid-axial approach is recommended. After injection of local anesthetic, make a small skin incision slightly larger than the diameter of the chest tube. Attach the introducer needle to a syringe filled with local anesthetic and administer additional local anesthetic to the skin and underlying tissues. Advance the introducer needle over the superior border of the rib and into the pleural space. Fluid or air should be aspirated to verify an interpleural position. Over-insertion of the needle and/or dilators may result in serious harm to the patient. The needle should be introduced and directed with appropriate orientation inferiorly or superiorly. When the appropriate drainage site has been identified, advance the soft J end of the wire guide through the needle and into the pleural space. The wire guide should pass through the needle and advance into the pleural space without resistance. The skin level marker on the distal end of the wire guide can be used as an insertion depth marker on patients with normal anatomy. Remove the needle, leaving the wire guide in place. Liberally inject additional local anesthetic into the intercostal muscles surrounding the wire guide. While maintaining the wire guide position, dilate the tract and opening into the pleural space by advancing, in sequence, small to large, the supplied dilators over the wire guide. Introduction into the pleural space is facilitated by rotating and advancing the dilators in line with the wire guide to prevent its kinking. Over-insertion of the needle and/or dilators may result in serious harm to the patient. It is important to have enough length of wire guide exiting the access site to facilitate controlled introduction of the dilators. The dilators only have to enter the pleural space to their full diameter and should never be advanced beyond the distal end of the wire guide. With the wire guide still positioned within the pleural space, advance the chest tube inserter chest tube assembly over the wire guide and into the pleural space. If resistance is encountered during the chest tube assembly insertion, determine the cause of resistance and take necessary action to relieve resistance before proceeding. It is important to advance the chest tube assembly into the pleural space in the same line as the wire guide. This will make introduction easier and avoid kinking of the wire guide. The distal end of the chest tube inserter should not be advanced beyond the distal end of the wire guide. Remove the wire guide and chest tube inserter, leaving the chest tube in place. It is important that all side ports of the chest tube are positioned within the pleural space. The chest tube can now be sutured to the skin and is ready for use.